greetings that we missed up front. Before I do that, I just want to mention our distinguished patrons and our key sponsor, Her Excellency Sheila C.D. Monteith. Mr. Seth George Ramakan, Consul General and as the Sunday Group people are not here, but Martin Gerbin, the Vice President of Sunnybrook International, is our key sponsor and host. Now, we are going to ask everybody else to do brief greetings so we can get through everybody, because we still have refreshment back there until you want to greet us. And we have our very dynamic performer to come on after. So we want to hear her, we have to make this presentation. Okay, so at this point we're going to ask Professor Ying to bring his greeting and to bring his greeting and that of his partner who is absent, Mr. Earl Jarrett, who should be here, is on a plane coming in. He probably is approaching the airport now. So, Prof.
Thank you very much, Kingsley. Good evening, everyone. Are you still out there?
Yeah.
Okay, good. Well, let me start, in case you don't hear anything else that I say. First of all, let me bring you greetings on behalf of the chairman of the Diaspora Foundation. That's Mr. Earl Jarrett. He's in the air right now. I think he'll be landing somewhere around 10 o'clock tonight. But his office asked me to bring greetings on his behalf. The Jamaica Diaspora Foundation and its operating arm, the Jamaica Diaspora Institute, was set up by the government coming out of recommendations, again from the conference in 2004. So here we are today. Very briefly, I've been involved with this forum, and I feel like a midwife, and I hope that I'll have a successful delivery tomorrow, because I was drawn into this on Sunday afternoons when Kingsley and his team called me up, and we were engaged in these many hours of teleconferences. I know this conference was going to be very successful because it had the following indicators. First of all, in the first set of meetings, each person thought that they had the best idea as to what the theme should be, the purpose, the objectives, and the topics to be discussed. As you heard already, we have 3,000 Jamaicans overseas and descendants, and each 3 million. And each one is a leader. So you can imagine when they meet in planning forums like this that everybody wants to be the leader. My task really was to be a good listener, a mediator, a counselor, and somebody who separates people if they were getting into too many conflicts. The good thing about it is that, having been a university professor, I learned that you have to be able to put contending points of view together. So having listened, all I simply did was listen to everybody, did a draft on October 7th, 2013, sent it back out to everybody else, and all the tension subsided, because now they had something to read. And here we are today. I'm very pleased that all the differences of opinions and all the anxieties have been subsided, and now we're going to be launching a very successful conference. Somebody had to lead the pack, and since we have 3 million leaders, we, as Romans would say, we need a primus inter pares, which is a leader among equals. And hence, and by decree, Kingsley Gilliam was now fully in charge. And if you know Kingsley, when he's in charge, he keeps at you. So he calls me while I'm on the road, he calls me on Sundays, he calls me all the time. I was very happy in some of those calls that his wife and daughter needed him urgently. So that was, Kingsley, I was very delighted when I heard your wife calling in the background. I said, good. Now I have at least half an hour less of calls from Kingsley. But that's the nature of Kingsley. When he gives a commitment to do something, you know it's going to be done. Just to put things in context, this forum follows many important events which preceded it. The ideas came out of the conferences. There was a forum in Minnesota in 2010, followed by a fact-finding mission by the health group in 2011. Then we had a diaspora conference in 2013, and there were several recommendations out of it. And so we are delighted that we're here today to launch this very important forum. And I look forward with great expectations to this very productive event that we'll have starting tomorrow. Thank you.
Thanks, Bob. At this point, we will call on Ms. Celia Grandis Marquis. Okay. Yeah, well, one second, Mike.
Celia, he's been calling you, so.
Come from far.
Come from far, and I called her before, and it was a little premature, but yeah, my apologies. See you.
Thank you. Good evening, everyone. Good evening. Before I say anything, I'd like to confirm what Minister Brown said about Mary Seacole. We are putting a statue up in her honor in the UK. It will be in the grounds of St. Thomas's Hospital. And we're hoping that on the anniversary of her death, which is next May, we'll be able to have the final £500,000 to have that statue erected. And I have got some of her badges with me, which you can purchase as conference goes on. Okay, so let's move on then to what I would like to say is all protocol observed. And it gives me great pleasure on behalf of the members of the Jamaican diaspora in the UK and also the members of the health sector group to be here and to give you a welcome from the United Kingdom. What we would like to stress is that we congratulate the working group under the auspice of Kingsley for the work that they've done. We are also very mindful looking at the topic of the subject for the week, that sustainable partnership is a critical issue and it smacks in everything that is done. In our belief, sustainable partnership indicates the bringing together of other health sector leaders, business leaders, and individuals who are very heavily involved in the scale of change. Because it's only through the scale of change where knowledge, research, experience can be shared to make things happen. And for the scale of what we're taking on to support Jamaica's 2030 strategy, that is important for successful, sustainable help to our homeland. We also want to stress that the work we've undertaken and that Kingsley has undertaken in the forum today it has no boundaries, because we're dealing with health, and healthcare is ever-changing. And because it's ever-changing, it costs finances. And finances that within Jamaica's 2030 strategy for health that the Minister has taken on board requires us to give that input to help and make that happen. And I see this forum today as crystallizing some of those areas to enable us to contribute more to Jamaica's healthcare. We also want and hope that the conference will not just act as a conference, but it will create networks whereby active strategies, operational and leadership for sustainable healthcare will benefit Jamaica in itself. We recognize and hope that the participants will explore and share their understanding, will relate and share research findings, which is whatever we do, and in whatever way we enhance care, it has to be based on research findings. We also want to be sure that the changes that we're hoping to create will remain sustainable. And the only way that will happen is that the co-benefits and strategies that individuals will be bringing to this conference will be implemented by us all. And when I say by us all, I'm not talking about just those who are in healthcare. The majority of our support comes from businesses, friends, elderly persons who contribute towards that healthcare. And I feel that today Canada is basically saying we want to engage, and we in the UK are happy to support that engagement. I'd also like to stop at this point by saying that the UK is extremely pleased and excited, in fact, to be a part of this process. And I know Professor Ying talked about the planning and how that went. But what it has done, it has brought us together. And Kingsley, thank you. And we do hope that as a group of people together, we will work together, we will maintain and support Jamaica's 2030 strategy. Thank you.
This is Claudette Powell from United States.
Thank you. Good evening, everyone. I'm Claudette Powell, President of the Caribbean American Nurses Association, past President of the Jamaican Nurses Group of New York, and I'm the current co-chair of the Jamaican Diaspora Health Sector, Northeast USA. So I'm wearing several hats here tonight. However, the current president for the Jamaican Nurses Group, Donnerine Denny, is here with me. Say that I'm so pleased to be here because it has been a journey to get here today with this Jamaican Canadian Foundation Forum. This all began since 2010 at the Vision 2030 Healthcare Forum in Minnesota, where a group of us met with the high personnel, Jean Dixon, Minister of Health, at the time, who was the Minister of Health? Whomever. Brother Spencer, I guess, and others, to talk, to develop the strategic framework for the health system, the public health system in Jamaica. And I'm happy to say it's now 4 years later and the journey has continued, and today is another part of the journey. And after the 2010, in 2011, we went to Jamaica, to the Jamaican Diaspora Conference, and I have to say, history was in the making. There, we presented the Vision 2030 strategic framework, and I vividly remember Kingsley stood there and endorsed the US presentation, and that's where it began. And followed suit by the UK, Celia Granderson, I have to thank you too. So since 2011, it has become an international health sector. Have regular monthly conference calls, to discuss our strategies or our initiatives, lots of cooperation, and I'm really, really happy to thank Valerie Steele and Kingsley from Canada, and Celia and our others who could not make it, and Mr. Waylon Richards. Okay, Waylon is the leader there in the United States. So it's Waylon, Dr. Roy Street from the Organization of International Development, and myself. We have spearheaded the health sector in the US. And it continues. We have held different conferences. We have come up, you heard earlier, the minister spoke about liaisons. We have accomplished a lot. And I'm sorry it's not much time to let you know, but the health sector has a lot to report. You can see me during the next 2 days. We can share more. Pardon me? Oh yes, and we are compiling for the 2015 Diaspora Conference. Lot to report. But one of the things that I must mention to you, we did a fact-finding mission. And that's where we were able to make it an international fact-finding mission, because I had representatives from Canada, whereas Dr. Enid Collins was there, UK and US, and we visited about 24 health facilities on the island, and we didn't just want to leave there saying from hearsay. We met with persons at various levels, from administrators to the porter, patients. We listened to them. What are the needs? And we compiled a need list. And we went back under the leadership of Professor Ying. He told us how we needed to put this together. And we looked at 5 areas: infrastructure, professional development, equipment and supplies, and information technology. We realized that there's a desperate need for medical records. I believe it's in the making now for that. And I'm bringing all this to your attention. And I have to say that it's still a long way to go, but we have touched on each area. There are various groups, some of them we don't even know about, that are contributing to the island. I know the Jamaican Nurses Group is involved in the education of trying to help with continuing education for the nurses. And with that, we have donated several textbooks to the University of the West Indies, the University of Technology. And one other thing I must say before I sit, we heard so much about, today I've learned 2 buzzwords: engage and organize. But there have been 2 others bouncing around: collaborate and partner. All the ministers have always put about collaboration and partnership. So now there are 4 words that we're going to be concentrating on during this conference and beyond now. Because all along, I really learned to master collaboration and partnership. And because of that, we have the president of the Nurses Association of Jamaica here, stand, Antoinette Patterson. This is also history in the making. She has joined, she's a part of the Diaspora Advisory Board to the Ministry of Health. And all this came out of the Health Sector Initiative. And the relationship with the Jamaican Nurses Group of New York has really developed. And all this is a part of under the umbrella of the diaspora. Who else we have here? Somebody else that we have a Dr. Claudette Gardner here, who's here with us today. She's going to be a presenter. Oh yes, I heard that today. So we have developed long-lasting relationship. I understand there's someone in Australia who might be joining our call soon. So right now the international relationship is UK, Canada, and US, but we're going to pick up as we go along. And so Kingsley, and Valerie, thank you very much for coming on board, and Celia. And again, we are making great strides. You heard earlier about the education sector. You might be saying, what was I doing there? I know why I was there. I felt that if the education sector was meeting to develop, to look at the education, the children, health has to be a part of it. You cannot educate them without them being healthy. So I have to say that I took the floor and I raised a motion how the health sector will be collaborating with the education sector to look at the food and nutritional status of the students. Again, I thank you very much. I'm very pleased to be here. I'll be here until Saturday so we can talk throughout the time. Thank you very much.
Thanks, Claudette. And I think it's appropriate at this time to mention that Claudette Powell, Wayland Richards, and Dr. Roy Street, and their respective organizations. Claudette, the Jamaican Nurses Group of New York; Wayland, the Organization for Strategic Development in Jamaica; and Dr. Roy Street, Organization for International Development, were the core group that created the health sector. They organized the Minnesota Forum, and out of this came the finalization of the Vision 2030 Plan for Health. And at the Diaspora Conference in 2011, when the